everybody, my name is Paula and welcome to Nurses. I'm a Year 3 nursing student at the National University of Singapore, and today I'm making this video series for those A-level students or poly students or whoever, even your parents who are interested to know more about the NUS nursing curriculum and the NUS nursing experience. And this will be a few-part series. Here are the series titles. I'm gonna upload all of them all at the same time so that you can just choose and see which one you would like to focus on. I will link the rest of the videos down in the description below. I have my laptop in front of me as my cheat sheet, so when I'm looking down, just know that I'm looking at my laptop. For this video, we are gonna be talking about the NUS nursing curriculum, lessons, lectures. I get a lot of questions whether it's hard, whether bio is needed. Let's begin. This is the curriculum overview of NUS nursing. As you can see, the first 2 years we focus on learning the different body systems, how they function and dysfunction. That's the anatomy, physiology, and pathophysiology. And then we also learn about fundamentals of care. You'll be taught on what nursing is, the basics of nursing, and what you have to take note of as a nurse. Then we move on to interesting modules such as communicating effectively with your colleagues, doctors, physiotherapists, occupational therapists, whoever, and communicating with your patients and patient relatives as well. On the second year, we move on to more specialized modules such as mental health nursing, ethics and law, women and children health, which is the module for obstetrics and gynecology. The third and final year for most, I'm going to talk about that later, we will focus on gearing us for eventual practice in the clinical setting. This third year is mostly focused on teaching modules like leadership, community health, and research even. Finally, we embark on a 3-month clinical placement to emulate the real pace and nature of the work so that they know that we can actually function in the ward as a registered nurse when we graduate. That is called the Transition to Professional Practice Experience, which carries 12 modular credits. Okay, now we move on to honors versus no honors. I'm not sure if you guys have noticed, but in the NUS nursing website, you can graduate with an honors degree or you can graduate within 3 years for a non-honors degree. What is this honors degree, and why do some people take it and why do some people not take it? Honors year is actually a year-long research project, usually in the student or the mentor's area of interest. So faculty, staff members, and like hospital staff will act as mentors for these projects. And some examples of research projects can be found here. These are just some examples. I just took them from the NUS nursing website. What is the difference between honors and no honors? Basically, the first difference would be the starting pay. Some hospitals do pay those with honors degree higher than those without honors degree, since you have like a higher qualification than those with honors degree. But the difference depends on the hospital. It's not fixed, and it also depends on the kind of honors classification you get. So if you get first class honors, you may be offered a higher salary than that who got second class honors. If you want, you can just look at the annual graduate employment survey here, which says the average or mean or median salary that NUS nursing graduates get for both with honors and non-honors. Other things, some overseas masters or PhD programs actually require either an honors degree directly or even a normal bachelor's degree with a few years of experience. So for that one, of course, you have to check with the overseas or even local masters and PhD programs. Some hospitals and employers, some may view honors degree more favorably. It really depends on the hospital and whichever employer, if you want to be a clinic nurse or whatnot. The complete information is on the NUS nursing website. It's subject to changes every year. So what I recommend would be to go to the NUS nursing website and then just look through every single tab that they have, because they regularly update the information there anyway. Then we move on to day-to-day lessons. So day-to-day lessons pre-COVID was really fun because we have this simulated ward. So it's like fake wards in school where we learn all our nursing skills, we practice on mannequins, and that some of them can even breathe and have pulses and things like that. It was really fun pre-COVID because we were there, I'll say most of the time, but more regularly than currently during the COVID-19 pandemic. We also have this thing, very exciting thing called standardized or simulated patients. We call them SPs. So I don't know, some people call them standardized, some people call simulated. I don't really know what it is, but anyway, SPs. SPs are basically actors, paid actors. So they're basically paid actors who act like they are sick, or they can even act like family members so that we can simulate what happens in the ward. We can do like skills, procedures to them, like we can take their blood pressure and things like that. Sometimes they'll act as angry family members and then we have to know how to deal with them. So it's quite exciting, honestly. I just had mine last week. There was this really angry SP acting like an angry family member, like, where's my brother? Where do you transfer him in the ward? In this kind of situations, you have to know how to deal with it because in the hospitals you will see a lot of those things. Okay, then lectures and tutorials. So pre-COVID it was like half video lectures, half face-to-face lectures, but now during the pandemic it's, I would say last year it was like 100% video lectures and like Zoom tutorials, but now I think they're starting to open up a little bit more, although majority is still online. I think for some modules they do allow face-to-face tutorials if necessary, but the pandemic is not gonna leave us anytime soon, so we have to really get used to online lessons. Yep. For the video lectures, you can watch them at home at any pace you want. So you can times 1, times 1.5 speed, or times 2 speed. Pre-COVID, the school is only around 3, max 4 days a week, and only 2 to 4 hours of lessons each day. However, I want to remind everybody that this is during my time. It may change during your cohort, so don't take my word for it. Anyway, I just want to remind everybody that there's plenty of time to work or have CCAs, but of course there's a lot of lectures to watch, tutorials to attend, textbooks to read, so it's not like you won't have to do much studying outside the 2 to 4 hours. But if you can manage your time well, I have friends whom I know who have a lot of CCAs, extracurricular activities basically. They stay in hall, have a lot of activities there. So life is really very happening. Then we move on to those who are worried about having no bio background. Do you need bio in NUS Nursing? Are you gonna be disadvantaged if you haven't taken bio since secondary school? I mean, since Sec 2. I know some people took physics from Sec 3 onwards, so you are quite worried that you haven't taken bio for 4 years. Okay, so for this question, I will be very frank. If you haven't taken bio in 4 years, you will have a steep learning curve, since those people who have taken bio before, they know how to study bio. They have tips and tricks already, up their sleeves on how to memorize. They're used to memorizing bio stuff. If you have taken physics, yes, you memorize formulas and all, but you most likely don't memorize whole chunks of texts. But the good thing about NUS Nursing is most of our exams are actually MCQs. MCQs, skills assessment, so that's when you do wound dressing and stuff. There's only one module in my time where we had to write essays, but most of the exams are MCQs. So the good thing about it is you are not required to reproduce the information, you are required to recall, since it's mostly MCQs. But MCQs also doesn't mean it's just like very obvious answers. It's not. You have to have critical thinking as well when it comes to the questions. It's not like what is the powerhouse of the cell, then you see mitochondria there. No, it's not like that. It's like they'll give you a whole clinical scenario and then you have to know what you're gonna do as a nurse. In order to arrive at the answer, you have to think what happens in, like, when a patient has that disease, for example, and then what you have to prioritize as a nurse, blah blah blah. Okay, so Okay, back to having no bio background. So there are people in nursing who haven't actually done bio since Sec 1 or 2, or even those from Poly who did non-science courses. I have friends who did like international business or mass communication. But the kind of bio that we learn is actually very different from the H2 bio that we took in A-levels. So H2 bio deals with the very minute things like oxidative phosphorylation and ETC and Krebs cycle and all these like small molecules that you have to memorize and all. In NUS nursing, we deal with humans here. Okay, in medicine, we deal with humans. Human anatomy and physiology, the human body and how it dysfunctions. The anatomy and physiology mods are the closest thing I can alluded to would be Sec 3, Sec 4 O-level bio, where you learn about the heart and how the blood flows in general, then how it dysfunctions, what kind of drugs would the doctor give. You as a nurse have to know the side effects of the drugs so that you know what to look out for if the patient, for example, has an allergy to the drugs. However, you wouldn't need to delve too deep into the molecules at all. That's for the medical students to do. There will be a lot of medical terms. You have to be ready for that if you join nursing or any healthcare related field actually. And it will be hard at first, but once you get the hang of it, it will come naturally. These medical terms, right? I took bio all the way from Sec 1 to like JC2, but it was still very hard for me because it's like learning a new language, you know. They use Latin phrases, Greek phrases, which you really just have to memorize. After a while, I think most of us took about 1 sem to like even a whole year in order to be familiar with the kind of terms that they use medically. But trust me when I say that once you reach year 2, year 3, you'll be very comfortable with the medical terms already. And right now, I only vaguely remember feeling so overwhelmed because now I'm so used to the medical terms, you know. So trust me, you will get used to it. And then for those scared of blood, why are you joining nursing? Okay. No, for those scared of blood, actually, you can still join nursing. I even have friends who join medicine who are scared of blood, like they, really will feel kind of faint and all when they see blood. During nursing school, we have cadaveric sessions. What this means is that you get to see real, preserved human bodies, and you are required to touch and observe them, look at the texture and all during those anatomy sessions. So for example, for my time, I don't know if they still do this now during the pandemic. Definitely during my time, we had those sessions where we look at the heart of a cadaver, which is a person who has passed on and who donated their body to science. So preserved heart, preserved lungs, preserved liver, preserved whatever. So they're hardened already, and you can they are cut into half, for example, and then you can see those heart valves and things like that. I enjoyed those sessions a lot. Actually, those were the highlights of my NUS nursing curriculum because I don't know, I think it's just something else when you learn things face to face and when you can connect the things that you learn from the textbook when you see the real thing in your hands. Yeah, they don't look like fresh organs anymore. You can actually search science cadavers to see what they look like. And then as for blood, generally you have to be alright with the sight of it, as the first lab session in NUS nursing, the fake lab that I was talking about, the simulated lab, simulated wards, they call it lab. There will already be finger prick glucose tests that you do on your friend and vice versa. So during clinicals, you may be exposed to all sorts of things like wounds that are bleeding, so you have to be okay with it. And like what I said earlier, I do have friends who enter nursing school who are afraid of blood and needles, but you can get used to it through repeated exposure. As a real nurse, you have to be alright with these sites, as there may be some instances where the patient vomits blood or starts bleeding somewhere, and you have to manage the patient. If you are scared of blood and get posted to the operating theater as an OT nurse, then you will be assisting doctors in their operations and you will see blood. I suggest that you start trying to watch like YouTube videos to see if you can take it, but I just want to let everybody know that you can get used to it. There are people who started medicine or nursing who are scared of blood, but now because they've been exposed to it so many times, it's nothing to them already. And the same thing goes for needles. If you are scared of needles, if you are super scared of needles such that you can't like give injection, start practicing. But if you are just scared of getting them, then it's okay, because like a lot of people in nursing are also scared of like getting jabbed, but they can give people injection, Segue, but please get your COVID-19 vaccine because it will really help Singapore to like get out of this pandemic. Yeah, okay. For lecturers and tutors, all teaching staff in ALCNS are previously doctors, nurses, or pharmacists for pharmacology. Usually, our heavily science-based modules are taught by previous doctors. For example, modules like anatomy and physiology and pathophysiology. Whereas more nursing-based modules are taught by previous or even currently practicing nurses. This honestly helps us a lot because our lecturers and tutors have all these experiences that they can share with us in the clinical world, and therefore they are able to better relate what they are teaching in the clinical setting. I really salute NUS Nursing for this, because for me, the classes I've been in and the teachers that I have encountered, they really know their stuff. Like, they will teach one thing and then they will share some of their clinical knowledge or some of their own experiences so that we can remember it using their examples. Nursing degree versus nursing diploma for Polytechnic students. The main difference would be the pay and the job scopes. For the pay, the main difference will be around $800 to $1,000 monthly depending on the hospital. You come out as Staff Nurse 1 with a degree and Staff Nurse 2 with a diploma. So Staff Nurse 1 is one position higher than Staff Nurse 2. Promotion may be faster. Pay may go up faster, but really that depends on the hospital, your performance, the kind of like nursing managers you get and things like that. For pay, honors degree holders earn about $3,500 a month. Okay, so that's about it. If you guys have any other questions, I will leave a Google form link down below so that you can ask questions. I will answer those questions during the live session that we have on the 6th of March on the NUS Nursing Instagram and my own Instagram at NurseSays. Okay, stay tuned for the next part of the series. See you!